nominations of this year's Heroes of Mental Health Award. We had more nominees this year than in previous years combined. The nominations were truly inspiring. We have incredible human beings here in our community whose passion is remarkable. One of those great people is being recognized today for her leadership and devotion to the healing of emotionally injured children. Her work has positively impacted the lives of thousands of children and families in southern Colorado over the past 20 years. These children have experienced loss of a parent, friend, family member through suicide, deployment, death, or divorce. They have suffered physical, mental, or sexual trauma. Her nationally and internationally recognized model of care serves over 200 children and families per year at no cost. And while she's an ordained elder with the First United Methodist Church, she helps children from a variety of faith traditions, including those with no faith traditions. Ladies and gentlemen, our 2011 Hero of Mental Health is Dr. Leanne Hadley, President and founder of First Step Spirituality Center. Dr. Hadley.
Award, and I got a corsage. Thank you so much. Before I thank you for the award, I just want to thank AspenPointe for being heroes of mental health each and every day to our community. I send children on a regular basis. I refer them to AspenPointe, and they are so well taken care of. And when my own child got into trouble this year, makes me cry, I sent him to AspenPointe. And I knew that you would take good care of him. So thank you, AspenPointe. You are our heroes, and thank you for this award. When I started First Steps, I think that First Steps Spirituality Center is the first center of its kind in the country to provide spiritual support to hurting children and teens. I dreamed this idea up, and then I had two questions. I wondered, would people come? Is spiritual support something that people need and that children particularly need? Would they come? And my second question was what the mental health community would think about a spirituality center in the midst of what you're already doing. My first question was answered quickly because people started coming and could see the value in bringing their children to a spirituality center. My second question was also answered very quickly. The mental health providers of this community reached out to me almost immediately. In fact, they would call me and say, what are you doing? And I would say, did they say I was a psychiatrist? I'm not saying I'm a psychiatrist. I was very paranoid. And then they would say, no, what are you doing? Go to lunch with me. I want to know how you can help my clients. And they reached out to me. Sharon Nelson, I don't know if she's in the room, but she was on call for me for 2 years because I, would say, Sharon, how do I know when I need to make a referral? How do I know mental illness from just regular grief? And bless her heart, she mentored me time and time again. You sent children to me, you referred children to me, you sent your own biological children to me for help, and you have nurtured me and our spirituality center in ways that I cannot even begin to tell you today. And Dr. Fred Michelle, who I am eternally grateful to, helped me during my doctorate work to articulate a model of pastoral care, which again I think is the first model of spiritual care for children that's been written down. And what we discovered as we worked together is that while we have different approaches, I come at it from a spiritual perspective, you from a psychiatric, psychological perspective, that really we do a lot of things the same. And I think that, I hope that today is more than just a recognition of me, but maybe a launching point where we can continue to be in dialogue to say, how does this all fit together? You know, and I know that children and teens and adults are very complex people. And it takes a village to meet their needs and to help them find their mental health. It takes teachers and doctors and nurses parents and friends and mental health providers. And today we honor you by saying that spirituality has a role in that village as well. I just want to thank you for letting me be part of your village. We all have one goal, right? To help these children and teens and adults find the mental health that they deserve. And I love being in your village and working side by side with you. Thank you so, so much.